Hello, I'm Gary Schaefer. Welcome back if you've been watching my videos. If this is your first time, welcome, and hopefully you'll look at some of the videos I have online. I am the author of A Family Story of Addiction, Death, and Recovery. Myself and Emily sit down with Laura Fishman. She's a psychotherapist for addiction. She has over 20 years experience. We cover addiction from her point of view and what she sees, the effects on the individual, the effects on the family, and the roles the parents and loved ones should be playing to prevent or to help someone deal with it. So give a listen. Hopefully you'll get something out of it. Please share to help others. Thank you.
Hi, welcome back. My name is Emily and I'm here with Gary again. I am a mental health clinician, been in the field for around 6-ish years or so. And today we are joined with Laura. Laura, if you'd like to introduce yourself.
Thank you. Hi, I'm Laura Fishman. I'm happy to be here. I am a psychotherapist in private practice. I've been doing this about 20 some years. And I specialize in addiction, codependency, eating disorders, personality disorders, depression, and anxiety, among other things. But
wow, that's
those
a
are
list.
that's kind of a
That is a list.
Yes.
I might have to get some supervision from you or something. So Laura's gonna talk with us today about life in private practice and specifically working with clients who are facing addiction and working through sobriety and recovery. So is there what a typical session would look like for you with a client who's working through addiction? I'm sure it depends.
Yes, it depends on the client. It depends on the age of the client and kind of where they are in their their journey. Many times I'm seeing clients who aren't ready to admit that they have a problem. And so a lot of our work is just really going over facts about their life, and what we'll focus on a lot of is kind of the consequences of the behavior, which oftentimes when a person is in it, they very much want to justify or deny or minimize, especially if there hasn't been any major crisis, or legal issue or anything like that. It's easy to justify why it's not that bad. So right. It really depends. So a lot of times my work is even sometimes getting the client to a point where they can say, I have a problem.
Yeah, so we're looking at those stages of change.
Yes.
And a lot of them
yes.
are in that pre-contemplation.
Yep. And we very often are stuck in the first stage for a long time.
That's a hard stage.
It's a hard stage.
Because you don't want to put any kind of blame or shame on them.
Yeah.
But you want to help them see, hey, these actions are leading to these consequences. And how does that affect your life? Are you happy with that?
Exactly.
Are you ready? Do you feel the need for a change? And so that can be really tough.
Right. And go ahead.
Do some of them come in, if they're in that first stage, do some of them, are they forced to come, or are they?
Depending on the age of the client, if it's a client's over 18, no. I mean, right. And unless it's a court-ordered situation, and so yes, they are obligated to be there. If we're talking about a minor, I would say majority of the time the client is there because mom and dad said it's time. It's time.
Okay.
And there may be some resistance or the parents have kind of said you're going to therapy, at least give it. And I always tell working with parents, especially with minors, that say we're gonna give this at least 6 sessions. Mm-hmm. So and after that we can evaluate. But again, you never know. I mean, I've had clients who come in and absolutely sit in silence and won't say a word.
I'm here because I'm forced to.
I'm here because I'm forced to, and silence is the strongest form of control that there is, and you cannot do anything with somebody who's not going to talk to you. So, so that can be challenging.
For sure, especially with the minors,
because
yes, they're so resistant, and you have to build that rapport with them to make them feel safe and like they're human and you're right. Not judging them and like, hey, what's up? How's it going?
Yes.
Like, let's talk about some things.
So
that's a long stage, and then you get to the topics of why maybe they're there.
Mm-hmm.
It's tough.
It is. right. So so it can vary, and then I do a lot of work also with families, and I refer to it kind of as parent coaching, a lot of working with codependency.
Yeah.
So that's a big part of it. In fact, many times I'm working with the parents even before I'm working with the client.
We went through that
Yes.
when we first got involved in it,
Yeah.
because we just got sucked into everything he was doing.
Yep. Yeah, especially if the client is so resistant, then I'll, again, and this is if we're talking about a minor. It gets a little tricky when you have somebody over the age of 18, because they, it's voluntary, and so especially if I have parents that are coming to me with, a minor, I say, this is, the earlier the intervention, the better. So let me help you and give you some tools, which that's hard too. I mean, the parents show up, but they often want to minimize or justify, or, so there's a lot of education that goes into it.
Do you find that parents who are bringing their child in for substance use want to kind of drop their kid off to you and say, hey, fix them?
Sometimes, yes. Sometimes, yes.
Because it's hard to put in that work and like maybe admit or come to like an honest understanding that your child's suffering. And so it's like, they're kind of your problem for the hour.
Yes.
Like, work with them, and then we'll take that step back.
Right. And thinking that hour, or, if we have so many scheduled sessions, that is going to be the, the answer to everything. And very often it's not. It's one component of, I say, as you're getting, you're dipping your toe in the water of recovery. Because there's obviously other, depending on where the client is, I may have to refer out to a day program, an inpatient program, recommend meetings and so forth.
Well, when I went to Al-Anon for the first few times, I thought it was, okay, this is how I can fix Eric.
Yep.
You have a total misunderstanding that you can fix the child.
That's it.
And as Lisa brought up in the previous video, there's that invisible line where you're taking a choice that you want to drink or do drugs, and then you cross that line, and now the drug or alcohol controls you.
Yep.
Do you find you have them on both sides of that invisible line?
I do, and it's hard because yes, parents want to come in, and if they're willing to, to learn and to be educated, yes, they're thinking, give me the formula, and hand it to me, and then this will help. And they want to treat it like it's a behavioral problem. And I always say, it has behavioral components, but it's not a behavioral problem. And that one is a really hard one to wrap their heads around too, because it's really it's a brain disease, and it's a complex brain disease.
And that's something you guys learned.
And that's where we went. We thought it was a behavior problem because we didn't understand the invisible line.
Yep.
We thought we could keep on twisting them by the old, we're going to ground you, we're going to take this away, we're going to treat it as a behavior problem. And that just drives the parents up a wall.
It does.
I mean, it does, because you don't get the reactions that you want to get.
Well, and what else is invisible is dopamine, right? Which is in our brain, and that's our reward system. Which natural ways to get dopamine can be through nutrition or sleep or pleasurable activities. And especially at the age of onset for using, you're basically altering your dopamine. You're tricking it. And so that's where it becomes, a need, not just even a want, and where people want to say, oh, it's discipline or self-control. The dopamine is invisible, and you can't see what's going on in your brain. You can only see behavior.
Right.
And you can judge behavior. So that, I always say that's a line that's invisible, which is hard because you don't recognize that. And that's part of the education.
So going off of like the chemical aspect and the brain development, we know that the brain isn't fully developed until like mid-20s-ish. If there is a minor or a younger individual who is still in the development and they begin substance use, how does that affect the brain's development?
It stunts it, is what I say. It basically puts it on pause. And it will kind of remain on pause depending on how long the usage goes for. And so what we're talking about too, because the prefrontal cortex is, our decision making, our judgment, our impulse control. And when you're talking about, adolescence, let's say, which is very much often characterized with some of those behaviors and some of, experimentation and stuff, it's the perfect storm. unfortunately. So you have a minor who may, want to be trying something, may want to be, but obviously they're not recognizing how their brain's working. But also the development of executive functioning, which is critical, right? That's our time management, our organization, our ability to just focus, those things. So that gets put on pause, and which impacts, you think about that almost everything. And at least, and it may be subtle initially. So as long, the longer the person is using, I always say, think of a remote control, and you're pressing pause. The brain develops until age 25. If somebody is using up to the age of 25 or even longer, it can restore itself. If somebody does go into recovery, it can restore itself, but there's a whole lot of relearning that has to happen. And that's the tricky part too about addiction or substance use disorder, is that I always say, abstinence from the drug or alcohol is part of, that's sobriety. But recovery is so much more than just the stopping of the drug or alcohol. It's relearning how to communicate, how to identify your feelings, how those executive functioning aspects that may have been put on pause.
And that's where I think parents and loved ones have to understand, as somebody's in recovery stage, they're not going to go back to being, I want to use the word normal.
Right.
They
Right.
have to relearn a lot of things.
Yes.
And for us, as we went along with Eric and learning, we didn't understand that his brain is on pause, as the term you used, because when he was using, he'd be 22, 23 years old, and I'd go, what is he thinking?
Right.
He's thinking like a 15-year-old or a 16-year-old, and
Maybe he was.
and he probably was, right?
Yes.
Yeah.
Yeah.
And
Right. So it basically, I think, depending on the time of usage and the amount, yes, it basically stunts your brain growth. So, right, you may be in your 20s, 30s, 40s, but you're operating your emotional immaturity, all of your, ability to function, to a full extent is stunted. But the person going through that, of course, they don't recognize that. They don't. They're not. That's not on their radar at all.
And because their current behavior with their use is their norm.
Is their norm? Yes.
And so on the outside, people see.
not normal.
Yeah, but on the
Sure.
for them, they're with themselves every single day. They can't escape themselves. So this is their norm. This is typical behavior for them.
Right.
And they don't see that.
And then not to mention when you start having an addiction, right, that's where the dopamine, and that's the invisible chemical that we can't see, it requires it to feel quote unquote normal, right? So that's the other thing too. And so from the outside, it can look like, somebody's just making a poor choice. Why do they keep doing that? And I often, when I'm working with families, I say, the definition of insanity, doing the same thing over and over again, trying to get a different result.
Oh yeah, I learned that.
And that's, substance use disorder very much mimics. That's what it can feel like. And, from people on the outside watching the individual, it's like, come on. How many times do you have to hit your head against the wall before you say, I'm not going to do that anymore?
Yeah.
But there's so much more going on to it than just that. Yeah. Even their pain receptors are even on pause as well. So that the dopamine, that's what, we want to feel good. That's the reward system.
Right.
So our brain craves it.
It's just processing all that is so interesting, and it just makes you think.
Yes. It
is so complex.
It is.
It is that, and most parents, I don't think we understand it, and we don't understand that invisible line because we're treating it, back to your point, as a behavior problem. And then as they don't react, they get closer and closer to whatever that invisible line is, and then you're dealing with a whole new ball of wax.
Yep. And I think that invisible line is a moving target too. I don't know if you can say it's the same, what is
for each person?
For each person, for each person. Yeah. So that's also, it'd be a lot easier if there was information that said, okay, just look for this, and then it's not that literal. It's not that black or white.
Okay, because that was kind of leading into my next question is, how do we know when we're approaching that line, if we can identify that? And I'm sure I'm sure that's different by each person and what that would look like in their,
Yeah, it is. And again, age, I keep saying that because, if we're talking about a minor, I think things to look at or look for, definitely mood changes, which can sometimes come with adolescence anyway. So, but
without the
with,
alcohol,
without, right.
drugs,
I mean, so
yeah.
that's what makes it, tricky.
Difficult
Yes.
of what you catch.
Yeah.
Is it normal for his age or is it something
Correct.
else?
Yep. So mood changes, I think academic, school changes, if there's any, a drop in academic progress. I think even looking at socially, it really requires parents to be aware. And that's easier said than done, because the nature of addiction is to be very secretive.
Oh, yeah.
I mean, that is, and so that is extremely hard. So I can give, people signs and symptoms to look for. But the person who's using becomes a master at hiding.
Yes.
So sometimes it's not, I mean, if it's easily visible, it's a lot, but oftentimes it's not. But it also brings up the question of what is normal experimentation versus when do we get into, and I think experimentation we often experience in adolescence, which does not mean we have to go off and do wild and crazy things. We just need to be aware of what's going on with our kids and who they're hanging out with. And just because, especially alcohol, I would say, is more normalized and more easily, accessible, doesn't mean that it's okay.
Right.
And again, what we don't know, this is the invisible, there's a lot of invisible lines, I think, as we're talking about this. You don't know how one person's brain is going to react to drugs or alcohol that may be different than somebody else's.
That's a good point.
And that's where, I can't treat addiction, substance use without also looking at the mental health issue or part of it, because there's something going on. I mean, yes, it may be, I'm curious and I want to experiment. But then there's also something that what makes that person, go back to it and go back to it again, or go back to it excessively, or go back to it. Is it helping them feel better? Is it managing anxiety? Is it
managing pain?
Is it managing pain? Yes, right. And pain could be low self-esteem.
Right.
That's
very subjective.
Yes. Yeah.
Or they're not meeting the standards the parents set for them.
Mm-hmm.
That's right. Yep.
Yeah. Somehow that drug or the alcohol, whatever they're using, is benefiting them.
Exactly.
And it feels better, or it numbs, whatever it is, and they go back.
Right.
One thing I learned after Eric became sober, recovery, and he came back home and go to school, I had to learn what he was capable of.
Mm-hmm.
I pushed him into certain curriculum at college, and it was beyond what he could handle.
Mm-hmm.
So I think parents have to understand a little bit about, okay, what is the skill set, or what is the capabilities of your child that can add that stress in their life. Does that make sense?
Absolutely it does, which means a lot of listening and trying to understand. And I keep saying there's always another side to that, because it's hard if your adult child is not communicating with you.
Right.
Then again, it's really, it becomes tricky. So there's a lot of, which brings into where codependency starts to really flare for people who have a relationship with somebody who is addicted. Because our nature when we care about somebody is to want to step in and help and guide and coach and support and direct and all these things, which we have absolutely no control over.
Yep.
I know. I know. It's the
I think I talk about my job, supervise people. I was considered a expert in problem solving. So when I went in someplace, I was in charge. And sometimes we bring that home, that I can manipulate things and I'll fix things for everybody. Just listen to me and I'll fix it.
I'll fix it for
everybody.
Yeah, and that's where, like, with a family dynamic, you have to know your role in the household and be able to also separate that from work. And you have to know your different roles in different environments. And so, did you find yourself coming home with that
Oh, yeah.
professional hat on still
Yeah.
and
Oh,
not
yeah.
the dad hat?
I learned to take it off, but
Okay.
yes, I did. And Marlene would come home for us, with work, and she had a bad day at work. And I would try and fix it for her. And that's not, she just wants me to hear
Mhm.
Yep.
what her bad, well, you should do this, and you
Right.
should tell him or her that. And that's not,
I know.
they just wanted to vent.
Vent, to be listened to, maybe
Yeah.
some validation, and but I know the intention is coming from a place of
Right.
love, and that's where it's so hard. I think is, again, whether you're a parent, your spouse, it's almost it feels so counterintuitive, because as in educating about especially codependency and setting boundaries, which are, critical when
I
you're
learned that
yeah,
too, yeah.
yeah.
It's hard.
Yeah.
Boundaries
It's
are
so hard, and it feels, I keep saying, counterintuitive. If I see somebody I love suffering, why am I going to want to back away than lean into and help, fix, guide?
Yeah. I learned it's not bad. It's not wrong to say no.
That's absolutely true.
Nope. Yeah. Now, like with my 2 children, adult children now, I kind of stay out of their. If they come to me and ask me something, I'm more than willing to say okay, because they know I do have experience and stuff. But they make their choices, and
Right.
this is the consequence. So kind of think about it, but it's your choice.
It's your choice, yeah. Because otherwise, also, not to keep bringing up codependency, but I always describe it as a sponge. And we're absorbing all of the chaos and the anxiety and all of that from the other person. And then it affects our quality of life too. And you always hear the metaphor about putting your oxygen mask on first before you can help somebody else. If you're on an airplane, right?
Yeah.
If you're traveling on an airplane, you have to be able to breathe before you can even be present for somebody else. And codependency, it's another addiction, and that can be so hard. It's hard to separate, Gary, as you're saying, and just right, people are making their own choices, and we can't control that.
Yeah. No. Can't.
We can't. Yeah.
No, we can't. Sometimes you just have to step back and say, okay.
I know.
Live with your choice.
Yep.
What my father-in-law used to say was, you made your bed, now lie in it. And that's an old term, but with addiction, you kind of, you have to, when the kids are young, you got to step in at a point.
Yep.
But
Right. And that's where there are behavioral components to addiction, where yes, when if it's a minor and they're living at home, you set up consequences.
Right.
And so you're not enabling, and you do try to make it harder for the person to either access the drug or alcohol, or you want them to feel some discomfort from their choices. You can't control that, but that's where the boundaries come into play.
Right.
It's harder once
boundaries before they get into addiction.
Yes,
Because
exactly.
once they're into addiction, you set your boundaries, but it can be hell on earth.
No, they will bulldoze. They don't.
Yep.
Yeah, right. Yeah. So it goes back to the earlier the intervention, the better. The better the prognosis. It's always about prevention. If we can. Yeah.
Definitely. Have you had clients who have been in recovery for a long time and then relapse?
Yes.
Okay.
Yes. And I would say, probably, if I could say, kind of the common denominator in what causes that is a disconnection from either the recovery community. Just very often it's, I'm feeling better. That was so long ago. Can I have this one drink? It's not that. And going back to the rationalization and the justification, that's often where I see it starts to cause a setback. And or if there's maybe a trauma or something, and the person has said, their brain has told them, if you don't want to feel pain, use this drug or alcohol. So I sometimes see that being, you fall back on patterns that unfortunately help you feel better in the moment.
Right.
Not thinking
it's a quick fix.
It's a quick fix. Right.
Yeah.
Right.
So do you find that, and again, I'm sure it's very different case by case, but when people do fall back into their use, do they go back to where they were previously, like right before they got sober, or is it kind of another progression?
It's another, in my experience, it's kind of another progression. You know, when I've done, you know, when I educate or done presentations on addiction, I often kind of differentiate between, you know, what is the high functioning addict versus the addict? Well, addiction is addiction at the end of the day.
Right.
The high functioning piece, I think, adds an element of more pressure, more expectation of that they're showing up at work, or, you know, they haven't crashed yet. There hasn't been some consequence. And I think sometimes that pressure adds an element of more shame, which is at the core of addiction anyway, because a person is thinking, I have so much more to lose. And, you know, at the end of the day, addiction has the same journey, and it will has the same path for everybody.
It will eventually reach a certain point.
It will, whether you're a CEO of a company or you know, are homeless. It will yes, it has the same destination.
How many high profile people have we heard about being pulled over drinking and driving? And so it's, you know,
Yep.
it's hidden for a while. I mean, these are CEOs and everything else, and eventually it catches up to them.
It absolutely does. I mean, that's right. So that whole, you know, when people reference a high functioning, what does that mean? It just means, right, the addiction hasn't caught up, but it will. And that's something I always, you know, make sure people understand. It's a matter of time. It will. It's not, you know, will it or what, it will.
Yeah.
If you keep going on this path, it will. So I don't know if that answered your question,
That's
but
okay.
to kind of circle back. So I've seen, yes, I've had a couple clients that have really resorted and needed to go back into treatment, go back into some where I always say the difference between a full relapse and a setback is also something to pay attention to, especially, you know, if you're newly sort of into recovery. A relapse is when you're falling back on the same patterns and you know, you lose the ability to have any clarity and to understand, you know, the nature of your decisions. A setback is when you catch it, and it can be an opportunity to learn from. And to recognize, okay, what didn't I do? Maybe I didn't call my sponsor. Maybe I need more meetings. Maybe what happened? And sometimes we need those moments to learn from.
Right, they're learning opportunities.
They're learning opportunities. I mean,
you know, Eric went to AA meetings, so I would go to an AA meeting for an open talk that they would have. And some of the stories I heard was, I want to say shocked, but it was like, it was so easy for them to fall back in. It's like they're with a group who don't recognize or don't know that they're in recovery, and they're ordering drinks, and he goes, well, I'll have one beer, I'm sure that'll be fine. And next thing you know, they're right back into it just by...
That is absolutely true.
Because they don't want to maybe expose themselves or whatever it be. You know, I'll have a beer, I don't want to be out of sync with these people.
That's it. Right.
And next thing you know, on the way home, they're stopping to get a fifth.
Right. All it takes is that. And that, you know, you bring up a good point, because I think the more a person keeps it a secret, and you know, the example you gave would almost be somebody who's maybe ashamed or doesn't want to admit or doesn't want their friends to know, or that they have a problem. I mean, addiction loves secrets. And secrets, I mean, and shame feeds off secrecy. So all of these things are just, you know, basically, you know, pebbles to get to that next place. And that's hard. And so many times, and this is what is another, I think, component of recovery that becomes difficult. A person may have to really reevaluate or evaluate who are they hanging out with, and who is their peer group. And, you know, for a young person, that is extremely difficult.
To make new friends.
Yeah.
I'm working with one of my clients. Amazing kid. He just graduated college, and he's struggling. He's noticing how alcohol is impacting him, and he's not making the greatest choices. And we've talked about, okay, who are you spending time with? are they safe people for you?
Mm-hmm.
And, you know, just kind of working through some of those things. No pressure to change right now, but let's think about it.
Yeah.
Let's kind of evaluate where we're at.
Right. Right.
It's
You
hard.
make it interesting. You use the term safe of people. It was interesting after Eric had died, I came down and he had a bookshelf, and one of the books was Safe People.
Mm.
It's written by Dr. Cloud and Dr. Townsend. It's specifically, now it is faith-based, but it gives very good tips on why you're picking the people that you pick as friends and how to get yourself out of it.
Mm-hmm.
And how to look for people that are safe for you to have in your life.
Sure.
And
Right.
when you already have those established relationships, it's so hard when you're trying to get your body healthy and your mind healthy to step away from that comfort. Because they're your people.
They're your people.
It's what you know. And to step away from that is really scary.
Right.
Or try to find new relationships.
Mm-hmm.
How do I do that? Where do I look? What do I do?
Yeah, and the need for a sense of belonging, I think, is, you know, I think that's critical for all of us. And I think, yeah, especially for somebody who's going through, and that's where, you know, finding a sober community can be great, because that you can feel a sense of belonging, but that can be a very dramatic shift if you're leaving, you know, if you have to leave a peer group or a social group that you've been friends with for years.
I remember when Eric was in Florida living in a house where three guys, beautiful house down in Florida. It was a blessing for him. They were all recovery, okay? There's three of them. And they let Eric come in to try and help him along. Well, Eric got mixed in with a girl who ended up using and Eric falling off. But I remember I asked Eric, I said, you know, is she safe? And he basically said to me, this is resonates, things he has told me, he goes, everybody wants to be loved.
Yeah.
And it was a way for him to get somebody to feel good about himself.
Yeah.
Because the doctors told me he has low self-esteem.
Sure.
And they need that person to help them make themselves feel better about themselves. Does that make sense?
Absolutely. Yeah. Yeah. That need for connection, I think is so strong. And again, and we can have a rise of dopamine actually from that too. Natural rise of dopamine from through connections. So that makes a lot of sense.
One thing I learned in my Al-Anon group is we can control people by the silent treatment. People don't think it's a form of control, but it is, because you're taking away a relationship. You're taking away something from them that they require.
Mm-hmm.
So.
Yeah.
So you work in private practice, and I know you said that sometimes you refer patients or clients out to different types of programs. What would you, in addition maybe to coming to therapy, what would you recommend for some clients?
I think definitely joining when I say community, it could be AA. There's other you know, sober groups that I think is important. You know, sometimes it takes a little convincing. I think people, not everybody, but have preconceived, you know, ideas of, oh, it's a religious group or it's this, or, you know, and they, I'm not religious. And, you know, I always try to say it, you know, it doesn't have to be. I mean, yes, in AA, God is mentioned, but it's a higher power. It's whatever you want it to be. It can be nature. It can be, I mean, it's, and I really try to talk people, because you know, sometimes I think that's been used as a little bit of an excuse. But, you know, I have to respect other people, but because I really think AA is a strong community. And every meeting is different. So that's another thing I tell my clients, you know, if you go to a meeting, I had a client who was, I think, about 1920, went to a meeting. It was primarily people in their 50s, and he didn't feel connected. I said, well, okay, don't stop. Let's find another meeting. Because that's an important thing too. Because I think there's a lot of resistance in just, especially initially. So, you know, so I do think faith can be an important healer, and just, again, whatever that is, if that's religion, if that's something else, just some type of spiritual, that, again, to recognize we are powerless, and that there can be a lot of healing through that. So
Eric did a lot of searching when he was struggling, but I went to Al-Anon, which is not faith-based, but still they talk about the higher power. But I also went to a faith-based recovery. And the Celebrate Recovery, which is faith-based, okay, I tell them when I go there, I go, there's a lot of things in Al-Anon that I learned how to take care of myself. These slogans, one day at a time, keep it simple, for the grace of God. I mean, there's a lot of good stuff in there that gets you from a different viewpoint. Yes, faith is good. You use whatever faith you have. But there's a lot of other tools, I call them, out there that help me work through things. So for me, combining both of them helped me a lot.
Yes.
Helped me a lot.
Yeah. Yeah. And I really think a big component of healing, again, you know, as we're talking about connection or sense of belonging, and I think that's so important. And that's a unique and individualized for everybody. But I do think having some sense of purpose,
For sure.
is hugely important. And then also for the client to really focus and practice self-care. When I talk about that, I mean, you know, are you getting enough sleep? I mean, activity, nutrition, some of the things that somebody is just not really thinking about, but how critical that is in how you feel and how you wake up every day, and how that's important.
Oh yeah, not neglecting yourself.
Not neglecting it.
And I feel like sometimes people, and this can be for anybody with or without substance use, but they neglect themselves because they're so focused on work or their kids or X, Y, and Z that they don't care for themselves, and so that mental health goes down, and then maybe they do slip into some unhealthy habit, and then that's their way of coping and feeling better, and they think that's their self-care.
Right.
Back to your point too, and this is where I have no problem saying no, because too many people want to help, or they're involved with everybody else's junk.
Yes.
You know,
Yes.
it's like, I have certain things I like to do. And my kids may ask me if I can babysit. I got plans.
Good. Yep.
This is for me, and this is what I enjoy doing. And
And that's a boundary as well.
yes, correct.
You know, and it doesn't mean that you're going to say no every time because you have that one obligation, you know, but sometimes we just don't have that mental capacity in that moment to be like, yeah, I can do that for you. It's like, I have to take care of me so that I can help take care of you.
That's a
Yes.
Yep. Right.
Very good point.
Again, I have to put my oxygen mask on first before I put yours on. I mean, that's exactly, the concept of that too. So,
So Laura, you have read Gary's book?
yes,
What were your thoughts on it?
I think it's one of a kind, because I think it's such a raw, I mean, it takes you right into the heart of, you know, your experience, Marlene's experience. You get to know Eric more. It's just a very vulnerable, raw book.
That's a word I've used.
I mean, that's what it, and you learn so much about it. And I think Lisa, when she was here, had mentioned this to you too, but I think what's so helpful also is your admission of what went wrong, what you would do differently, and that's not to say you're to blame. And that's a huge differentiation. And I think that because guilt can be a poison to all of us, and coulda, shoulda, woulda, and that's not it's not anyone's fault. But I think that was I think that's helpful, and it sort of, again, it takes away some shame in the process. And I think somebody reading that, I hope, is going to realize, like, oh, he's talking about it, I can too.
It wasn't meant to be a book, which I told, but someone read it and says, you really need to put this out, because I never knew addiction was this bad. I never knew the harm and everything else. So I was kind of glad I wrote it as raw as I did and honest as I did. And we do deal with guilt, but then we have to go back and say, we did what we thought was the best to do. And there's nothing else
that is it
we could have done. Because I see a lot of parents who are still struggling 5, 6, 7 years after losing their child, where they literally don't come out of the house.
I know.
And it's kind of like, I view it as, I'm paying respect to Eric in his memory that we continue living, because I say he would kick my butt if we don't the day that I see him again.
Right. I mean, that's, and again, so that we're not, you know, there's so much pain, and if we absorb all of it, I mean, what do we do with that? So I think it's so important to learn to heal, and it's not easy. It's not easy.
No, it's
But you know, one thing I often have to work with my clients on, and family members also, is the definition of self-acceptance, which is, because again, it's so easy to say coulda, shoulda, woulda, but you're sitting here now with knowledge, awareness, experience that, you know, you didn't have then, and we're doing the best that we can. And it doesn't mean there isn't room for improvement, but we're doing the best that we can with what we have, with what we're equipped with at that moment, with what we know.
I try and tell them, try and take a step forward.
Mm-hmm.
You know, for me, as I'm wearing my Bob Dylan, because Eric was a huge Bob Dylan fan, and the Complete Unknown movie came out about Bob Dylan, so we had to go see it. And I will tell you, that was extremely emotional for me, just because of the connection to Eric.
Yeah.
I mean, I actually had to fight back tears a little bit, because when they were playing the Bob, certain ones of his songs, it immediately brought back Eric. I've watched it more than once, but each time I watch it, I can get through it better. You know, it's
kind of
so
exposing yourself to
It
those
is.
triggers. I don't know if triggers is the right word for that, but it's exposing yourself to the healing process. And a lot of people hide from that because it hurts too much.
I don't want to do that because it's going to hurt.
Right.
Where someone told me after, when Eric first died, says, you got to walk through grief. Let it, don't try to avoid it, because as you walk through it and feel the grief, you will start to heal. And that's what Marlene and I have noticed. Marlene, Eric being a chef, there's a fruit, vegetable, meat market by us. Eric used to love to go in there. Marlene couldn't go to it at first, but now she's able to walk through it. So it's, you know, you kind of keep on moving. I tell people, just keep on moving forward. Don't try to put a time limit on it. Just move forward, and you'll find that in time you will start to feel better.
That's it. Avoidance just makes everything so much harder and so much worse. It's the quick fix though, right? Right. If I don't have, it's the easier. Yeah. If I don't have to think about it or feel it, then it's over there. I can compartmentalize it, but that will eat you up.
And it's okay to take the baby steps with healing. Like, go outside for 15 minutes. If that 15 minutes that day was too much for you, okay, do 10 minutes the next day. You know, like, just take those little steps, and each little step that you accomplish is a win, no matter how big or small. And then over time,
that's a good point. It's a win. You just keep on getting wins.
Yeah. Right. Yeah.
Now, I'm gonna go into an area. You and I and Lisa, we're going to share what addiction is to a church.
Yep.
And when I first got in touch with them, they came back and they pretty much jumped in and says, yes, we would really like you to speak to parents. They asked me if bring our kids, and I says, bring the kids, bring the parents. I says, this is something that we need to wrap around. Now, I know different organizations send speakers into schools. 10th, 11th, 12th graders, okay? Based on data I've seen, we still have too many youths experimenting or using on a regular basis, which to me, when I tell people that we have speakers going into high schools, they kind of look at me, where was your head at 16 and 17 years old? And so they pretty much like my thought process of, we need to educate parents.
Absolutely. Yeah.
So they understand what's going on with their children, because they may not understand the pain or whatever they're going through in school. So although these speakers may tell them their story, how does it connect? You know what I'm saying? Because their brain isn't developed until 25. So I'm thinking, when I was 17,
right? Oh, sure.
I was like, I can quit what I want or whatever. I mean, do you kind of see that as?
Yes, very much so. Very much so. That's where the education needs to start earlier, and the intervention needs to start earlier.
And the parents are the ones.
The parents are the ones. And sometimes that's the struggle, is getting the parents to come in.
Yeah.
And you know, I think we're sort of in an era, and having, you know, my youngest daughter is just finished her freshman year in college, and what I saw among many of her peers, even in high school, which was just is a lot of parents have the attitude, well, I know they're going to drink or whatever anyway, so I'm just going to have them at home and I will supply it.
Yeah. Yeah.
And so, you know, you're kind of dealing with that because there's a justification. Well, I know they're going to do it anyway. So, so the key is trying to find something, having the parents show up is first and foremost. We need the parents to show up.
Yeah. And that's the hard part.
Yeah, that is the hardest part.
I've talked to organizations.
Yeah.
And Lisa even informed me that she's tried at her end. They can't get parents to show up.
No.
Parents don't show up until there's a problem.
They're in crisis.
Now they say, fix it.
Yep, that's it.
And the parents don't understand how much they're going to have to be involved. And I write in my book, our recovery is so important to the recovery of the person dealing with substance use disorder. Because if we're still messed up, and this is where I talk about when I started, understand is that I stopped putting pressure on Eric. I just had the boundaries for him, but I didn't ask him how his meetings were going. Are you going to meetings? Are you doing this? I mean, that just adds more stress
It
to
does.
him.
Right. Yep. Yeah. It has to be a journey that somebody is on, but
Yeah,
that's.
you have to understand, are you the one who's a trigger to them? Never know, because parents could be a trigger to
They
them.
could be.
And they don't want to believe that.
No.
No.
And maybe they're using themselves, or they're, or they have their own pain, trauma going on. I mean, that's why it is such a complex disease. But I always say, like with anything, I think the more we can get information, education out, it can only help. It
Right.
can only help.
Yeah.
So.
Without a doubt.
Yeah. Yes.
Are there any other points that either of you would like to bring up? Any other things that you guys feel are important?
I think we covered
I
it
think
pretty
we covered
good.
it. Yes, I think so.
I think this is very good between this one and Lisa's. A lot of good information that is out there.
Well, Laura, thank you for joining
Yes,
us.
absolutely. Thank you for
thank
having
you.
me.
Yeah.
Thank you. Anytime.
Yeah, so thank you guys for joining. And Gary, do we plan on doing more videos, or there's more?
We will.
Yeah?
We
All
have
right.
to discuss
We'll
what we
figure
want to
it
do
out.
next.
All right, cool. Well, with whatever that is, we will see you guys next time.
Thank you.
Thank you.
Bye.